Hello everyone, welcome to Ziso Health. Our lives are filled with all kinds of stress. Work stress, family stress, academic stress, financial stress, and more. However, in addition to dealing with these external stresses, our bodies are also subjected to various internal stresses. One of the most common and important stresses is the pressure generated by blood flowing through our blood vessels. If this pressure remains too high for an extended period of time, is what we commonly refer to as high blood pressure. Hypertension is a very common chronic disease worldwide, and almost everyone may be affected by it at some point in their lives. According to relevant medical survey data, the probability of developing hypertension in the general population is approximately 40%, and this probability is even higher in certain high-risk groups. For example, individuals with a family history of hypertension, obesity, lack of exercise, or an unhealthy diet. Additionally, age is an important factor in the development of hypertension, particularly among middle-aged and older adults, those aged 40 to 50, especially if they do not monitor their blood pressure or practice self-health management, are at a very high risk of developing hypertension. Furthermore, while hypertension is typically associated with middle-aged and older adults, its incidence is also on the rise among children and young adults in modern society. This trend is exacerbated by rapid urbanization, poor dietary habits, and unhealthy lifestyles, leading to an increasing number of young people developing hypertension each year. Additionally, hypertension during pregnancy is a common health issue. Gestational hypertension not only affects the mother's health, but may also pose risks to the fetus's growth and safety.
Hook her up to the fetal monitor and an EKG. Did you have preeclampsia before? Do you remember?
They said it was high blood pressure. It made my placenta tear, and if they didn't take the baby, I'd die.
Globally, hypertension has become one of the most common chronic diseases. According to data from the World Health Organization, over 1 billion people worldwide are affected by hypertension. In addition to its high prevalence, hypertension is also highly insidious, as it often has no obvious symptoms in its early stages, earning it the nickname, the silent killer.
I'd like to check your blood pressure.
Why don't you check your own blood pressure? Mine's fine, thanks.
Your skin tone suggests you might be suffering from arterial hypertension.
Don't tell me what I'm suffering from. And there are no visible signs of hypertension.
Since there are no symptoms in the early stages of hypertension, many people are unaware that their blood pressure has already risen to abnormal levels. If hypertension is not taken seriously and blood pressure is not effectively controlled over time, it can lead to severe consequences, especially when it progresses to malignant hypertension, which can cause heart failure, stroke, kidney damage, atherosclerosis, and even blindness. In severe cases of malignant hypertension, it can be life-threatening. Therefore, early identification and control of hypertension are crucial. In this video, I will delve into hypertension-related issues, including: what is hypertension? What are the risks of hypertension? What causes hypertension? How can hypertension be prevented? How is hypertension treated? What are the medications for hypertension and their side effects? All right, let's dive into this silent killer of human health, hypertension. Our bodies are filled with countless blood vessels that work tirelessly day and night to transport the fuel of life, blood. In the illustration, red represents arteries and blue represents veins. Arterial blood is pumped out by the heart and delivered to every part of the body, while venous blood carries blood back to the heart from all parts of the body. The force driving the flow of arterial blood comes from the beating heart. When the heart contracts, it pumps blood into the blood vessels, thereby generating blood pressure. This is similar to a water pipe. When the faucet is turned on, water flows out of the pipe, and the flowing water exerts pressure on the pipe walls. When the faucet is turned on, the pressure is relatively high, which corresponds to systolic blood pressure. When the faucet is turned off, the pressure decreases. Here, I'd like to add that even when the flow of water is very slow or stationary, the liquid still exerts pressure on the pipe walls, though this pressure is much smaller. This state is equivalent to the diastolic pressure of blood pressure. The principle of blood vessels is the same. Blood is a liquid, and when it flows through blood vessels, it also exerts pressure on the vessel walls. This pressure is called blood pressure. Blood pressure is the vital force that maintains blood circulation. Its primary function is to transport blood from the heart to all organs and tissues throughout the body, supplying them with oxygen and nutrients while removing metabolic waste products. To summarize, if we compare the human body to a car, the heart is like the engine, providing power. Blood pressure is like oil pressure, which drives the circulation of fuel in the car, while the blood vessels are like fuel pipes, serving as the channels for transportation. Throughout a person's lifetime, blood pressure undergoes significant changes due to aging, physical development, and lifestyle modifications. For example, at birth, an infant's blood pressure is typically very low, around 60/40 mmHg. This low reading is due to the fact that the newborn's vascular system is not yet fully developed and the heart's pumping capacity is relatively weak. As the infant grows, the blood vessels gradually develop, allowing the heart to strengthen its pumping power, and blood pressure gradually increases. Then, by around age 2, during childhood, blood pressure stabilizes at around 90/60 mmHg. This blood pressure is also relatively low because children have smaller hearts with lower blood pumping capacity, and their blood vessels are more elastic with lower resistance. Therefore, children tend to have lower blood pressure. Next, as children enter puberty, during puberty, the body undergoes rapid growth and development. This is because during this stage, the secretion of growth hormones and sex hormones increases. These hormones promote rapid physical growth and development, but also directly affect the cardiovascular system. Additionally, during puberty, metabolic demands increase, and the cardiovascular system gradually matures, leading to a gradual rise in blood pressure. As age increases, by the age of 20 to 30, blood pressure typically stabilizes around 120/80 mmHg. At this stage, the body's physiological systems, including blood vessels and the heart, have fully developed and reached their optimal state. During the 20 to 30 age range, blood vessel elasticity is excellent, and the heart's pumping efficiency is very high, enabling most people to maintain normal blood pressure levels. Then, when entering the 30 to 40 age range, people in their 30s and 40s face many challenges, such as career development, work pressure, financial stress, family responsibilities, changes in self-perception, conflicts between reality and personal ideals, and a lack of motivation and passion, among other issues. Additionally, many people in this stage lack sufficient exercise, engage in overeating,
And then I just saw Kate 2.0 slipping away. And the shame would keep building, and I'd keep binging, and my entire life has been a cycle of just
consume excessive amounts of salt and fat in their diets, drink alcohol excessively, smoke, and stay up late. These unhealthy lifestyle habits or factors can cause blood pressure to begin rising, though it may not yet meet the criteria for hypertension. However, if left unaddressed, the risk of developing hypertension in the future will significantly increase. Then, by the age of 40 to 50, the elasticity of blood vessels gradually decreases, and the vessel walls begin to harden. Blood vessels are elastic, and the younger a person is, the better their vascular elasticity. However, as people age, vascular elasticity deteriorates. This is because with age, the elastic fibers and collagen in the vessel walls gradually decrease, causing the vessels to harden over time. This hardening reduces the blood vessel's ability to expand and contract. Due to the lack of elasticity, the heart exerts pressure directly on the blood vessel walls with each contraction, and the blood vessels cannot expand to alleviate this pressure. Therefore, under the same blood flow, hardened blood vessels must withstand greater pressure. Additionally, once blood vessels harden, the resistance to blood flow increases, forcing the heart to work harder to pump blood to all parts of the body. This can lead to high blood pressure.
How did he die? No one will tell me.
Well, as one ages, one's heart tends to enlarge slightly, and the artery walls and arterioles become thicker, and then the elastic tissue within those walls and arterioles is lost. So a condition that appears regularly in the elderly is something called isolated systolic hypertension. And
Your pop was old.
By the time people reach 50 to 60 years old, the risk of hypertension significantly increases. This is especially true for those with a family history of hypertension, obesity, or an unhealthy diet. According to statistics, approximately more than half of the population begins to exhibit symptoms of hypertension during this age range. At this stage, hypertension is no longer an isolated issue, but a widespread health problem. Then, for those aged 60 and above, this stage marks the onset of old age, and blood pressure changes in the elderly are often more pronounced. As atherosclerosis worsens, vascular elasticity further decreases. Additionally, most elderly individuals have chronic diseases, reduced physical activity, and slowed metabolism, all of which contribute to a sustained rise in blood pressure. The previous section discussed changes in blood pressure throughout a person's lifetime. The timing and extent of these changes vary slightly between the sexes. In terms of blood pressure differences between men and women, men generally have slightly higher blood pressure than women between the ages of 20 and 40. This is because women have higher levels of estrogen during this stage of life, and estrogen helps blood vessels dilate and maintain elasticity, allowing blood to flow more smoothly and keeping blood pressure at a lower level. Meanwhile, men have higher levels of testosterone during this period, and while testosterone does have a blood pressure-lowering effect on men, its impact is less pronounced and less sustained compared to estrogen. Therefore, during the 20 to 40 age range, men generally have slightly higher blood pressure than women of the same age. However, as age increases, especially when women enter menopause, estrogen levels in the body gradually decrease and may drop significantly after menopause.
And we have it all going on in here, inside. We have pain on a cycle for years and years and years. And then, just when you feel you are making peace with it all, what happens? The menopause comes. The fucking menopause comes.
The reduction in estrogen causes blood vessel walls to become stiffer, increasing blood flow resistance and leading to elevated blood pressure. Therefore, women around the age of 50, especially after menopause, often experience a significant rise in blood pressure, which may even exceed that of men of the same age. This physiological change makes postmenopausal women more susceptible to hypertension-related conditions such as cardiovascular disease, atherosclerosis, and stroke. Therefore, women during menopause and postmenopause should pay closer attention to changes in their blood pressure. Earlier, we discussed how blood pressure changes throughout a person's lifetime. In fact, blood pressure also exhibits significant circadian rhythmic changes throughout the day. These changes are determined by a combination of physiological needs, activity levels, and nervous system regulation. Now, let's discuss how blood pressure changes throughout the day. We'll start with the morning, which is a critical time for blood pressure changes. When a person first wakes up, the sympathetic nervous system becomes active, and the body transitions from a resting state to an active state. At this time, heart rate accelerates, blood vessels constrict, leading to a natural rise in blood pressure. After morning, the body enters the daytime period, during which blood pressure typically shows a sustained upward trend. Especially during daily activities, exercise, or when responding to various external stimuli, heart rate accelerates, the sympathetic nervous system becomes active, blood vessels constrict, and blood pressure remains at a higher level. As evening approaches and evening activities decrease, the body begins to enter a resting state. At this point, the activity of the sympathetic nervous system gradually decreases, and the parasympathetic nervous system begins to dominate. The parasympathetic nervous system relaxes the body, slows the heart rate, and helps dilate blood vessels. Through the regulation of the parasympathetic nervous system, blood pressure begins to slowly decrease. The body enters a rest and recovery mode, preparing for deep sleep at night. During the late night, especially when entering the deep sleep phase, blood pressure typically drops to its lowest point of the day. This occurs because during late night hours, the body is fully relaxed, heart rate slows, sympathetic nervous system activity decreases, blood vessels remain dilated, and blood flow becomes smoother. As a result, blood pressure is relatively low. Emotions are also an important factor influencing blood pressure. Emotions can not only cause short-term fluctuations in blood pressure, but also have long-term effects on it. I will now discuss the impact of some common emotions on blood pressure. First, let's talk about stress. When people are under stress, such as in a tense work environment, facing an important exam, or encountering an unexpected event, blood pressure often rises rapidly in a short period of time. This is because stress activates the sympathetic nervous system, stimulating the adrenal glands to release large amounts of stress hormones such as adrenaline and cortisol. These hormones cause the heart rate to increase and blood vessels to constrict, leading to elevated blood pressure. In addition to stress, negative emotions such as sadness, anxiety, and depression can also cause chronic vasoconstriction, leading to elevated blood pressure. Especially under prolonged stress or negative emotional influence, blood vessels remain constricted for extended periods, keeping blood pressure consistently elevated. This chronic hypertension can damage the elasticity of blood vessel walls, promote atherosclerosis, and increase the risk of heart disease and stroke. Additionally, when a person is in a state of fear or anxiety, blood pressure typically rises rapidly. However, after an emergency or frightening situation ends, blood pressure drops immediately. This sudden rise and fall in blood pressure is a physiological mechanism that helps humans adapt to nature and generally does not have adverse effects on the body. However, if a person is constantly afraid, such as living in fear of domestic violence or being in traumatic situations for a long time, this can lead to chronic stress reactions, which also increase the risk of hypertension. Anger is another emotion that can cause a sharp rise in blood pressure.
Get away, bro! You and all your hateful...
What are you going to do now? Are you going to hit me?
Anger stimulates the sympathetic nervous system, causing the body to release large amounts of stress hormones, which significantly increase the heart rate and constrict peripheral blood vessels, leading to a rapid rise in blood pressure. If anger is experienced frequently and over a long period of time, it can increase the risk of arteriosclerosis, which can lead to high blood pressure. Of course, there are also some positive emotions that have a beneficial regulatory effect on blood pressure. For example, emotions such as love, relaxation, and meditation can promote the activity of the parasympathetic nervous system, helping the body relax, slow the heart rate, dilate blood vessels, and thereby effectively lower blood pressure. As I mentioned earlier, one of the most notable characteristics of hypertension is that it typically does not present with obvious symptoms. Even when blood pressure has risen to hypertensive levels, many people may not notice any changes or discomfort in their bodies. Therefore, the only way to determine your blood pressure and whether you have hypertension is through measurement using a blood pressure monitor. In the past, mercury sphygmomanometers were the most commonly used tools for measuring blood pressure. However, due to the toxicity of mercury and its environmental pollution, mercury sphygmomanometers are now rarely used. They have been replaced by electronic blood pressure monitors. There are two main indicators for blood pressure measurement: systolic blood pressure and diastolic blood pressure. Systolic blood pressure, also known as the upper number, refers to the highest pressure in the arteries when the heart contracts and pumps blood into the arteries, causing blood to flow. Diastolic blood pressure, also known as the lower number, refers to the lowest pressure in the arteries during the diastolic phase, when the heart relaxes between beats and blood flows back into the heart. On the display of a blood pressure monitor, SIS indicates systolic blood pressure, while DIA indicates diastolic blood pressure. Additionally, the monitor displays pulse, which represents the number of heartbeats per minute, also known as heart rate, measured in beats per minute, BPM. Typically, the resting heart rate for adults should be between 60 and 100 BPM. Blood pressure is measured in mmHg, a unit derived from the height of a mercury column. 1 millimeter of mercury represents the pressure required to raise the mercury level by 1 millimeter. Blood pressure readings are typically expressed as systolic/diastolic. For example, if a person's systolic blood pressure is 120 millimeters of mercury and their diastolic blood pressure is 80 millimeters of mercury, their blood pressure is recorded as 120/80 mmHg.
She's hypertensive, 170 over 120. Titrate a nitrile drip to a diastolic of 100. Ma'am, do you have a history of high blood pressure?
Oh, no, not again.
Okay.
Here, I will briefly introduce how to use an electronic blood pressure monitor and some precautions to take. To use an electronic blood pressure monitor, sit on a chair with your feet flat on the ground and your legs uncrossed. Place the armband of the blood pressure monitor on your upper arm, about 1 to 2 centimeters above your elbow, at the same height as your heart. Do not fasten the armband too loosely or too tightly. It is important to ensure that the cuff should be in direct contact with your bare skin, not over your clothing. Once the cuff is properly positioned, remain silent. Then press the start button on the blood pressure monitor. At this point, the monitor will automatically inflate and begin the measurement. The blood pressure monitor will gradually increase pressure through the airbag and then slowly release it. During this process, the monitor detects changes in blood flow and displays the systolic and diastolic blood pressure values on the electronic screen. The entire process takes approximately 1 to 2 minutes. Blood pressure measurements should be taken regularly, such as at the same time every morning. Multiple measurements should be taken, such as measuring once, waiting 2 to 3 minutes, and then measuring again. Repeat this process 3 to 4 times and record the average value. This will provide a more accurate blood pressure reading. Now that you understand the basic concepts of blood pressure, let's discuss how the human body regulates blood pressure. Understanding this will help you better understand the mechanisms of action and potential side effects of medications used to treat hypertension. The human body regulates blood pressure primarily through the combined actions of the nervous system and the kidneys, though the heart and blood vessels also play a role. Humans have an automatic blood pressure regulation mechanism. For example, in ancient times, people faced various dangers everywhere, such as hunting to survive, which often involved encountering dangerous animals. When faced with such dangers, the human body would immediately trigger a stress response, either to fight or flee. Stress refers to the physiological and psychological responses that occur when the body is exposed to external threats, stimuli, or challenges. During stress, blood pressure rises sharply, increasing blood flow to the brain and muscles to provide sufficient oxygen and glucose, enabling the brain to quickly analyze the danger and make decisions. Simultaneously, muscles receive increased oxygen and nutrient supply, allowing the body to escape or fight more effectively. Although modern humans do not face the same dangers as our ancient ancestors, we often encounter various emergencies in daily life. When humans encounter emergencies, blood pressure suddenly rises, which is a natural physiological response and regulatory mechanism of the human body. The body also has compensatory mechanisms, such as fight or flight. Once the danger or emergency has passed, blood pressure naturally decreases. Now, let's take a look at how the human body regulates blood pressure. As I mentioned earlier, blood pressure is primarily regulated by the nervous system and the kidneys working together. Here, I will first discuss the nervous system. The human body is covered with nerves, which together form the nervous system. Nerves are responsible for transmitting and processing neural electrical signals. Our vision, hearing, pain, and touch are all forms of neural electrical signals. You can imagine these nerve signals as electricity in real life. Electricity is transmitted through wires, and similarly, signals in the human body are transmitted and processed through nerves. Here, I will briefly introduce some terms related to nerves, neurons, nerve cells, nerve fibers, and the concepts and differences between nerves. This will make it easier for you to understand the process of blood pressure regulation in the human body later on. Nerves are composed of neurons, which are nerve cells. Neurons are the basic structural and functional units of the nervous system. The diagram below shows a neuron. A neuron consists of a cell body and projections. This is the cell body, with the neuron's nucleus at its center. The cell body is surrounded by dendrites, which receive information from other neurons. The long projection is called the axon, which functions like a cable to transmit information at high speeds. The end of the axon is the axon terminal, whose primary function is to transmit neural signals to the next cell. This is a neuron. What is a nerve fiber? A fiber is a thin, long structure resembling a thread, and this long segment is a nerve fiber. A nerve fiber consists of an axon and a myelin sheath surrounding the axon. The myelin sheath is an insulating layer that protects the nerve and significantly enhances signal transmission speed. Multiple nerve fibers form nerve bundles, which are bundled together to form a nerve. This nerve is similar to the electrical wires in our daily lives. Inside the wires are very thin conductors surrounded by insulation and protective layers. Just as wires come in different thicknesses, nerves also vary in thickness. For example, the sciatic nerve is relatively thick, while some sympathetic and parasympathetic nerves are relatively thin. Alright, the above is an overview of the concepts and differences between neurons, nerve cells, nerve fibers, and nerves. Next, I will introduce the structural composition and classification of the nervous system. The nervous system is divided into the central nervous system and the peripheral nervous system. The central nervous system consists of the brain and spinal cord. It serves as the command center of the nervous system, responsible for receiving, integrating, and processing signals from both external and internal sources. The peripheral nervous system comprises all nerves located outside the brain and spinal cord. It transmits signals from the central nervous system to various parts of the body or vice versa, conveying signals from the body's nerves back to the central nervous system. You can imagine the central nervous system as a highway, which serves as a transportation hub, while the surrounding roads and paths are the peripheral nervous system. The peripheral nervous system can be further divided into the somatic nervous system and the autonomic nervous system. The somatic nervous system is responsible for controlling skeletal muscle movement and perceiving external environmental stimuli. It is under conscious control. For example, you can actively control the movement of skeletal muscles, such as lifting weights, walking, or running, all of which can be controlled by your conscious mind. For example, if you want to lift a bucket of water, you have the intention, and the motor cortex in the brain sends neural signals. These signals are transmitted through the motor neurons in the spinal cord to the muscles in the arms and body. When muscle cells receive the neural signals, they contract, thereby completing the action of lifting the water. This process is entirely dependent on your subjective consciousness and is an autonomously controlled action. This action is controlled by the somatic nervous system. The autonomic nervous system, on the other hand, controls internal organs, smooth muscles, glands, respiration, digestion, and other organs. These organs are not under conscious control. For example, you cannot consciously control the speed at which your heart beats. Similarly, digestion, respiration, and other bodily functions are beyond conscious control and are automatically regulated by the body. Let me give you a concrete example: breathing. Many people might think they can control their breathing consciously, such as holding their breath. However, this is merely a deliberate effort. When you hold your breath, the carbon dioxide concentration in your body rises to a certain level, and your brain will forcefully trigger the breathing reflex. This is something you cannot resist with your willpower. Humans cannot suffocate themselves to death. Unless you are drowning, but drowning is not caused by holding your breath. It is caused by inhaling water, which leads to suffocation. This is caused by external environmental factors. It is important to understand that human control over the body is divided into conscious and unconscious control. Conscious control refers to behaviors that we can perceive, choose, and actively regulate. These reactions are processed at a relatively slower speed. Unconscious control, on the other hand, refers to instinctive reactions that we cannot perceive or actively control, and these reactions are processed very quickly. Alright, then the autonomic nervous system can be further divided into the sympathetic nervous system and the parasympathetic nervous system. We often hear the terms sympathetic nervous system and parasympathetic nervous system in everyday life. The sympathetic nervous system is responsible for emergency situations such as fighting or fleeing. It can accelerate the heart rate, increase blood pressure, and increase breathing frequency. The parasympathetic nervous system does the opposite. It is mainly responsible for recovery and relaxation. It can slow down the heart rate, lower blood pressure, and slow down the breathing rate. Our sleep is regulated by the parasympathetic nervous system. Now that we understand some of the basics of the nervous system, let's take a look at how the nervous system regulates blood pressure. The nervous system regulates blood pressure mainly through the sympathetic and parasympathetic nervous systems. For example, when a person is in danger or in an emergency.
Deva! Great!
Please slow down! Slow down!
When a person sees, hears, or feels danger, the amygdala in the brain quickly identifies it as dangerous. The amygdala then activates the hypothalamus, which stimulates the sympathetic nervous system. The sympathetic nervous system immediately sends emergency signals to various organs throughout the body. Simultaneously, the sympathetic nervous system stimulates the adrenal glands to release adrenaline and noradrenaline. These hormones stimulate the heart to beat faster and contract more forcefully. At the same time, these hormones also stimulate blood vessels to constrict, causing blood pressure to rise rapidly. Next, I would like to focus on the kidneys. The kidneys are urinary organs, and many people think that they are only related to urination. In addition to being related to urination, the kidneys are also important organs that regulate blood pressure. Let's take a look at how the kidneys regulate blood pressure in the human body. There is a large molecule called angiotensinogen in the blood vessels. When our blood pressure is low, or we encounter an emergency, the kidneys release renin into the bloodstream. Renin breaks down angiotensinogen into multiple fragments, one of which is angiotensin 1. Angiotensin 1 itself has little activity, but under the action of angiotensin-converting enzyme, is cleaved into a fragment called angiotensin 2. This angiotensin 2 is highly active and can cause blood vessels to constrict, thereby increasing blood pressure. At the same time, angiotensin 2 stimulates the adrenal glands to release aldosterone and the pituitary gland to secrete antidiuretic hormone. Aldosterone, a hormone, causes the kidneys to retain sodium and excrete potassium. Our table salt contains a large amount of sodium ions, which have a water-retaining property. If the sodium concentration in the blood is high, it will attract water into the blood vessels, increasing blood volume and thereby raising blood pressure. Here, there is a term called blood volume, which refers to the total amount of blood circulating in the human body. You can imagine it as the amount of water in a pipe. For example, when we receive intravenous fluids in a hospital, it is a way to increase blood volume because intravenous fluids are directly injected into the blood vessels, thereby increasing the total amount of fluid in the vascular system. An increase in blood volume leads to an increase in blood pressure. Additionally, the pituitary gland secretes antidiuretic hormone, ADH. The function of ADH is to reduce urine output. Since urine is primarily composed of water, reduced urine output leads to more water remaining in the blood vessels, thereby increasing blood volume. An increase in blood volume results in elevated blood pressure. Here, I will repeat that when the adrenal glands secrete aldosterone, it causes sodium retention, leading to salt retention. Salt retention refers to the abnormal accumulation of sodium in the body, primarily from dietary salt, which is not excreted normally and instead accumulates in the body. Salt retention increases blood volume, which in turn raises blood pressure. The above are the primary mechanisms by which the human body regulates blood pressure, involving the nervous system, kidneys, hormones, and other mechanisms working together to maintain blood pressure. When blood pressure rises to a certain level, the body activates corresponding compensatory mechanisms to prevent further increases. In other words, blood pressure does not rise indefinitely. The body has its own system to regulate blood pressure downward, helping to gradually restore it to a relatively balanced state. After laying the groundwork with a lot of information about blood pressure, I will now formally discuss the blood pressure standards for hypertension, i.e., at what point your blood pressure is considered high. According to standards set by organizations such as the American Heart Association and the American College of Cardiology, blood pressure is typically categorized into 4 main groups. The first category is normal blood pressure, defined as a systolic blood pressure below 120 millimeters of mercury and a diastolic blood pressure below 80 millimeters of mercury. This is the ideal blood pressure range for the human body, indicating that the cardiovascular system is in good condition. Children and young, healthy individuals generally fall within this normal blood pressure range. The second category is prehypertension. The criteria for prehypertension are systolic blood pressure between 120 to 129 millimeters of mercury and a diastolic blood pressure below 80 millimeters of mercury. This range is at the upper limit of normal blood pressure. Here, I would like to clarify that systolic and diastolic blood pressure do not rise or fall simultaneously. For many young people with hypertension, both systolic and diastolic blood pressure often rise together. However, for many elderly individuals, the systolic blood pressure increases while the diastolic blood pressure may remain normal or even decrease. This condition, where systolic blood pressure is elevated while diastolic blood pressure is normal or decreased, is referred to as isolated systolic hypertension. This term was also mentioned in previous videos.
As one ages, one's heart tends to enlarge slightly, and the artery walls and arterioles become thicker, and then the elastic tissue within those walls and arterioles is lost. So a condition that appears regularly in the elderly is something called isolated systolic hypertension.
For the second category of prehypertension, Although the diastolic blood pressure remains within the normal range, the systolic blood pressure has increased, indicating that the cardiovascular system is under increased stress. This is a precursor to hypertension, and the risk of cardiovascular disease begins to rise. Some subhealthy individuals age 30 to 40, such as those who are obese, sedentary, lack exercise, have unhealthy diets, or experience high work stress, generally fall into the prehypertension category. The third category is stage 1 hypertension, with systolic blood pressure between 130 to 139 millimeters of mercury or diastolic blood pressure between 80 to 89 millimeters of mercury. At this stage, blood pressure is considered mild hypertension and risks begin to emerge. Increased pressure on the heart, blood vessels, and kidneys may lead to complications such as heart disease, stroke, and kidney disease. Many middle-aged individuals with unhealthy habits like smoking, drinking, and a high-salt diet are at risk of developing stage 1 hypertension. The fourth category is stage 2 hypertension. The criteria for stage 2 hypertension are systolic blood pressure of 140 millimeters of mercury or higher, or a diastolic blood pressure of 90 millimeters of mercury or higher. Stage 2 hypertension is classified as moderate to severe hypertension. At this stage, the cardiovascular system is under increased strain and the risk of organ damage significantly increases. Most middle-aged and elderly patients with hypertension fall into the stage 2 category. The above are the 4 common types of hypertension, but there is also a more severe form known as hypertensive crisis. Hypertensive crisis is defined as a systolic blood pressure of 180 millimeters of mercury or higher and a diastolic blood pressure of 120 millimeters of mercury or higher, which is classified as extremely high blood pressure and represents the most critical state of hypertension. This blood pressure level can lead to acute complications such as heart failure, stroke, retinal damage, kidney failure, and even death. Hypertensive crisis requires emergency treatment.
8 times the charm.
You trying to piss off Foreman?
Just let...
BP's 240 over 140.
Turn that thing off, will you?
Take the needle out. Take the needle out.
Hey. It's a hypertensive crisis. Start her on IV low-pressure drip, titrate to systolic.
Now that we know the criteria for hypertension, let's discuss its classification. There are generally 2 types of hypertension, primary hypertension and secondary hypertension. Primary hypertension refers to hypertension without a clear cause. We don't know the culprit or why it developed. Approximately 85% to 90% of hypertension cases are primary hypertension. Although primary hypertension lacks a known cause, it is typically associated with multiple factors. I have listed several common factors below. 1. Age. Age is a very important factor in developing hypertension. The older you are, the higher your risk of developing hypertension, as the large arteries gradually become stiffer with age, reducing vascular elasticity, and the smaller arteries also narrow, making it easier for blood pressure to rise. 2. Lifestyle factors. Many aspects of daily life can influence blood pressure. I will list several common behavioral habits that affect blood pressure. 1. Smoking. Nicotine in tobacco stimulates the sympathetic nervous system and constricts blood vessels. Long-term smoking can lead to arteriosclerosis, causing blood vessels to narrow and harden, which can result in hypertension.
Lizzie, meet Tancred Baumgartner, 64. History of hypertension and peripheral vascular disease, 80-pack-year smoker.
2. Alcohol consumption. Excessive alcohol consumption over an extended period can stimulate the sympathetic nervous system, increasing heart rate and blood pressure. 3. High-salt diet. Long-term consumption of excessive salt can lead to increased sodium levels in the body, which can increase blood volume and cause blood pressure to rise. 4. High-calorie diets and obesity. High-calorie, high-fat diets can lead to obesity. Obese individuals have increased body fat, which increases the areas requiring blood supply, thereby increasing the heart's workload. The heart must pump blood more forcefully to deliver it to distant areas. Additionally, obese individuals have heightened sympathetic nervous system activity. This means the body is in a state of heightened alertness, similar to the fight or flight response, leading to tension, rapid heartbeat, shortness of breath, sweating, and poor sleep. The increased cardiac workload combined with sympathetic nervous system activation can result in elevated blood pressure. 5. Lack of exercise. Many people today spend long hours sitting at desks, and many office workers lack physical activity. Inactivity affects the body in various ways, such as weakening blood vessel function, causing weight gain, disrupting the nervous and hormonal systems, and disrupting metabolic balance. These changes can all contribute to elevated blood pressure. Alright, the above are some ways in which lifestyle affects blood pressure. Psychological factors. Another factor affecting blood pressure is psychological factors. Long-term stress, anxiety, or depression can cause the sympathetic nervous system to remain in an excited state, leading to vasoconstriction and elevated blood pressure.
This ain't gonna fly, man. The Ricans, we got genetically higher blood pressure, you know that? My cousin, he died from too much stress.
Genetics. Genetics also plays a role, as hypertension has a clear familial predisposition. If parents or immediate family members have a history of hypertension, their children are at a higher risk of developing hypertension. For example, African Americans have a very high rate of hypertension. Besides socioeconomic factors, a significant reason is genetics.
That's because almost 40% of black men have it. That means that almost every single black man either has high blood pressure or knows a black man who has it.
Now, let's look at secondary hypertension. Secondary hypertension refers to hypertension caused by other specific underlying conditions. It has a clear underlying cause, and 5% to 15% of hypertension cases fall into this category. There are many diseases or factors that can cause secondary hypertension. This table lists some of them, and I will list and explain some common diseases and factors here. The first is kidney-related diseases. Kidney diseases are the main cause of secondary hypertension. As I mentioned earlier, the kidneys play an important role in regulating blood pressure. If the kidneys are not functioning properly, the body's ability to remove sodium and water is impaired, leading to an increase in blood volume and, consequently, elevated blood pressure. Second, atherosclerosis. Atherosclerosis refers to the process by which arterial walls thicken and harden due to the deposition of substances such as fat, cholesterol, and calcium. As people age, especially after 40 to 50 years old, vascular elasticity gradually decreases and the elasticity and flexibility of arterial walls diminish, making them more prone to hardening. Atherosclerosis can lead to hypertension. Third, endocrine disorders. Endocrine disorders involve diseases of the endocrine glands, such as the thyroid, adrenal glands, pituitary gland, and pancreas. These glands secrete hormones which transmit signals through the bloodstream to regulate various physiological functions in the body, including metabolism, water-salt balance, stress responses, and, of course, blood pressure. Common endocrine disorders include hyperthyroidism and diabetes, both of which can cause hypertension. Fourth, medications. For example, some cold medications, pain relievers, contraceptives, and certain psychiatric medications can cause blood pressure to rise. Fifth, drugs. For example, cocaine, methamphetamine, and amphetamines. These substances strongly stimulate the sympathetic nervous system, releasing large amounts of norepinephrine and epinephrine. These hormones can rapidly cause blood pressure to rise. The above are some of the diseases and factors that can cause secondary hypertension. I would like to add a note about coffee. Coffee is a very common beverage in daily life, and many people believe that the caffeine in coffee can cause blood pressure to rise, so they recommend avoiding it. Regarding this issue, I will explain that the caffeine in coffee can stimulate the central nervous system, promote the release of adrenaline, cause vasoconstriction, and increase heart rate, leading to a temporary rise in blood pressure. However, this effect typically lasts only 1 to 3 hours. The impact of blood pressure fluctuations caused by drinking coffee on the body is actually very small. Additionally, drinking coffee has many other benefits, such as improving attention, enhancing mood, protecting cardiovascular health, and promoting metabolism, among others. As long as you are a healthy individual and do not consume excessive amounts of coffee, it is a very healthy beverage. For me personally, I drink coffee almost every day to stay alert while creating videos. Now that we understand the criteria and different classifications of hypertension, let's discuss the specific harm it causes to the human body and its related complications. Complications refer to new problems or diseases that arise during the course of a disease or treatment that are related to the original disease. Simply put, it is a case of one disease leading to another. You already have one disease, and then because of that disease or its treatment, a new disease arises. Disease A causes disease B, and disease B is the complication. All right, next, I will introduce the main risks of hypertension to the body. The first risk of hypertension is its impact on the heart. Hypertension poses a particularly severe risk to the heart. It causes the heart to endure prolonged high loads, leading to ventricular hypertrophy and enlargement, which can result in heart failure and arrhythmia.
There are also lifelong risks, such as high blood pressure, which can cause a heart attack, and protein-losing nephropathy.
2. Stroke. A stroke occurs when blood circulation to the brain is suddenly obstructed, causing brain cells to die due to ischemia or hemorrhage within a short period of time, resulting in acute dysfunction of bodily functions. Hypertension accelerates atherosclerosis, narrowing the arteries in the brain and obstructing blood flow, ultimately leading to stroke. 3. Harm to blood vessels. Hypertension accelerates vascular hardening, causing significant damage to blood vessels. Severe cases can lead to aneurysms, which are dilations of arterial walls. Hypertension increases pressure on blood vessel walls, potentially leading to aneurysm formation, especially in the aorta and cerebral arteries, which is highly dangerous. If the aorta ruptures, it can cause severe bleeding and be nearly fatal. If a cerebral artery aneurysm ruptures, it can lead to cerebral hemorrhage, causing a stroke with severe consequences.
The aneurysms look mycotic, but they're not. They're inflammatory. It's because it's not a fungal infection. The hypertension was a real symptom. I've been unwittingly treating it with beta.
4. Damage to the kidneys. Hypertension damages kidney blood vessels, causing glomerular damage and reduced kidney filtration function. Over time, hypertension may lead to chronic kidney damage, which can progress to kidney failure, uremia. Uremia can only be managed through dialysis or kidney transplantation to sustain life. The 5th risk of hypertension is damage to vision. The eyes contain a rich network of blood vessels, particularly the retina, which has numerous tiny blood vessels. Elevated blood pressure can exert significant pressure on these small vessels, and prolonged hypertension can damage the blood vessels in the eyes, leading to retinal ischemia, bleeding, and edema. In severe cases of malignant hypertension, this can result in permanent vision loss. The above are some of the main health risks associated with hypertension. The primary risks of hypertension lie in its damage to vital organs such as the heart, brain, kidneys, and eyes. If hypertension remains uncontrolled or untreated for an extended period, it may lead to various complications. Therefore, it is crucial to detect and prevent hypertension early. However, most hypertension patients have no symptoms, and only a small number may experience some symptoms. As blood pressure continues to rise, more noticeable symptoms may appear. Now, I will discuss some of the early symptoms that may manifest in hypertension. 1. Headache. Headache is one of the most common symptoms of hypertension. When blood pressure rises sharply, blood vessels in the brain may dilate or spasm, stimulating the nerve endings around the blood vessels and causing a headache.
Carter. Tom Angevine. What happened, Mr. Angevine? Going to a lunch appointment, then I get this sudden blinding headache and straight into a tree.
Pressure's 210 over 160.
Do you have a history of hypertension?
Yeah, I'm taking Vasotec and Lasix.
Headaches caused by hypertension are more noticeable upon waking in the morning and may subside as the day progresses. The second symptom is dizziness. Hypertension can cause unstable blood flow to the brain, leading to dizziness, especially when standing up suddenly or changing body positions. Dizziness is particularly noticeable in such situations. 3. Blurred vision. Hypertension can damage blood vessels in the eyes, leading to blurred vision. Some people spend a lot of time lying down and using their phones or computers, while others experience rapid vision loss. If your vision deteriorates rapidly, it may indicate an underlying health issue such as hypertension, diabetes, or hyperthyroidism, which can severely affect vision. 4. Chest pain. Hypertension can increase the burden on the heart. The higher the blood pressure, the greater the pressure on the heart, which can lead to chest pain or angina. However, if the chest pain is severe and accompanied by symptoms such as difficulty breathing, nausea, or sweating, it may indicate a heart attack. 5. Tinnitus. High blood pressure can alter blood flow in the ears, leading to tinnitus, which is the perception of ringing or buzzing sounds in the ears despite the absence of external noise. Tinnitus is also a common symptom among patients with hypertension. 6. Fatigue or weakness. Long-term hypertension may lead to insufficient blood supply to the heart and other organs, resulting in physical fatigue and weakness. Many middle-aged individuals experience fatigue, and in such cases, it is advisable to check if their blood pressure is elevated. 7. Facial flushing. Elevated blood pressure can cause vasodilation, sympathetic nerve stimulation, and accelerated blood flow, all of which increase blood supply to the face, resulting in redness and heat. 8. Frequent urination or reduced urine output. Due to the impact of hypertension on the kidneys, some patients may experience abnormal urine excretion, such as frequent urination, reduced urine output, and edema, especially in the legs. This is because the long-term burden of hypertension on the kidneys and heart may lead to fluid retention, particularly in the lower limbs or ankles. The above are some symptoms of hypertension. These symptoms are often not noticeable in the early stages or in mild cases of hypertension. Most symptoms only become apparent when the condition is more severe. Additionally, some symptoms may not necessarily indicate hypertension, such as headaches, dizziness, facial flushing, or fatigue, as many people without hypertension may also experience these symptoms. Therefore, if you notice any symptoms, it is essential to measure your blood pressure, as measuring blood pressure is the only way to determine whether you have hypertension. Finally, let's talk about drug therapy for hypertension. Before discussing drug therapy for hypertension, I'd like to talk about prevention, which is actually more important than treatment. This is because hypertension often has no obvious symptoms in its early stages, and once complications arise, it has often already entered an irreversible stage. Hypertension cannot be cured at present, it can only be controlled. Once diagnosed with hypertension, long-term treatment, monitoring, and medication are required. This can be very tiring and costly, so prevention is extremely important. In fact, there are many common diseases such as cardiovascular diseases, hypertension, hyperlipidemia, hyperglycemia, many gynecological and pediatric conditions, infectious diseases, and even a significant portion of cancer cases. Most of these diseases are related to lifestyle and environmental factors, and their risk can be reduced through lifestyle interventions. With proper lifestyle interventions, it is possible to completely avoid these diseases or delay their onset. Now, let's take a look at the prevention of hypertension. The prevention of hypertension primarily involves lifestyle adjustments, which I have discussed extensively earlier. Let me summarize the main aspects of hypertension prevention. 1. Healthy diet. Reduce salt intake, minimize processed foods, and increase consumption of vegetables, fruits, and whole grains. 2. Regular exercise. Exercise benefits heart, lung, and vascular health. Engage in moderate-intensity aerobic exercises such as brisk walking, running, or swimming. You don't need to work out every day. Many people think that exercise must be done daily, but this is not the case. Our muscles, cardiovascular system, and nervous system need time to recover after exercise. Overdoing it with high-intensity workouts every day can lead to overexertion and harm your body. Aim for 3 sessions of moderate-intensity physical activity per week, each lasting 30 to 60 minutes, to maintain good health. Next, lose weight. If you are overweight or obese, weight loss is essential. Losing weight can effectively lower blood pressure. Quitting smoking and drinking. Smoking significantly increases the risk of hypertension, so smokers must quit. As for alcohol, many people claim that moderate drinking is harmless or even beneficial for health, such as drinking red wine. However, authoritative medical research institutions have refuted these claims. Alcohol is definitely harmful to the body, and moderate drinking is not entirely harmless. It simply carries a lower risk. Another aspect of blood pressure prevention is stress reduction. Stress, especially chronic stress, can affect blood pressure. When you feel stressed, especially under prolonged stress, you should find ways to remove yourself from that situation and relax through exercise, deep breathing, meditation, or other methods. Lastly, reduce exposure to environmental pollution. Environmental pollution also significantly impacts blood pressure, especially air pollution such as smog, which contains numerous tiny particles. Inhaling these particles can trigger systemic inflammatory responses, stimulate the sympathetic nervous system, causing vasoconstriction and elevated blood pressure. Noise pollution, water pollution, and indoor pollution can also lead to increased blood pressure. Therefore, if you are in a polluted environment, you should find ways to avoid it. Now, let's talk about the medication for hypertension. Although lifestyle changes can help lower blood pressure, people who already have hypertension need to take medication to control their blood pressure.
Sir, you should take a restorative. Something for your nerves. Your blood pressure is very high.
Do you hear that?
Blood pressure medications can help maintain blood pressure at healthy levels, thereby significantly reducing the risk of heart disease, stroke, kidney disease, and other conditions. There are many types of blood pressure medications, and here I will introduce the 5 main types. The first type is diuretics. As the name suggests, diuretics increase urine output. Since urine is primarily composed of water, this effectively removes excess fluid from a body, reducing blood volume and thereby lowering blood pressure. Diuretics are the first-line treatment for hypertension. Diuretics are generally not used alone, but are often combined with potassium-replenishing medications. This is because while diuretics promote urination, they also excrete potassium, which is an essential electrolyte in the human body. After exercise, we sweat, and sodium and potassium ions are also excreted from the body along with sweat. Therefore, we need to replenish electrolytes after exercise, especially after intense exercise such as marathon running, where athletes consume large amounts of electrolytes. During a marathon, athletes typically replenish electrolytes by drinking electrolyte-containing sports drinks. If you do not replenish the lost electrolytes after intense exercise, you may experience fatigue, dizziness, nausea, muscle cramps, or even irregular heartbeat. In fact, the amount of sodium and potassium lost through sweat is not significant, and most people do not engage in intense exercise frequently, so sweating is not excessive. However, if you use diuretics to frequently urinate, you will lose a significant amount of sodium and potassium through urine. Sodium can be obtained from salt and meals, but potassium is less readily available. Bananas and spinach are good sources of potassium, but not everyone eats them daily. Therefore, when taking diuretics, it is essential to replenish potassium. However, some diuretics already contain potassium, and these are called potassium-sparing diuretics. In such cases, additional potassium supplementation is not necessary. If potassium levels in the body are too high, this can also be problematic. Excess potassium in the body can lead to hyperkalemia, which can damage the heart's conduction system and cause arrhythmias. Diuretics are particularly suitable for the elderly, obese patients, and those with heart failure or kidney dysfunction. The second type is ACE inhibitors, which stand for angiotensin-converting enzyme inhibitors. Their blood pressure-lowering mechanism involves inhibiting the production of angiotensin II, thereby reducing blood pressure. These medications are highly suitable for patients with coronary heart disease, diabetes, young individuals, and those with chronic kidney diseases. The third type is angiotensin II receptor blockers, ARBs. The blood pressure-lowering mechanism of this drug is similar to that of angiotensin-converting enzyme inhibitors. This class of drugs directly blocks the action of angiotensin II to dilate small arteries. Its mechanism of action is more direct, so it has fewer adverse effects. The fourth type is calcium channel blockers. These medications work by blocking calcium channels on cell membranes, reducing the entry of calcium ions into heart and blood vessel smooth muscle cells. This dilates blood vessels, slows heart rate, and reduces cardiac workload, thereby lowering blood pressure. This medication is particularly suitable for young adults, the elderly, patients with angina pectoris, and those with migraines. The fifth type is adrenergic blockers, which include alpha blockers, beta blockers, alpha-beta blockers, and adrenergic blockers with peripheral activity. These drugs work by interfering with sympathetic nerve activity to slow heart rate and lower blood pressure. This type of medication is particularly suitable for young people, angina patients, and heart disease patients. However, it is not suitable for the elderly, as these medications carry a higher risk of side effects in this age group. The above are some of the main types of antihypertensive medications. Doctors typically prescribe 2 medications in combination to control blood pressure or select one medication for treatment. If the treatment is ineffective, they may switch to another medication. In principle, blood pressure medications require lifelong use. This is because hypertension is typically a chronic condition that cannot be completely cured. Therefore, long-term medication is necessary to control it. Most blood pressure medications do not cause side effects, but there are exceptions for certain special populations, such as pregnant women. Except for certain special populations, blood pressure medications only cause mild side effects, such as dizziness or headaches. Compared to the complications that can arise from untreated hypertension, such as heart, brain, or kidney issues, these side effects are negligible. Therefore, hypertension patients must never stop taking their medication on their own. You must strictly follow your doctor's instructions for medication and regularly monitor your blood pressure to ensure the medication is effective. If you experience significant side effects from a particular medication, you should promptly inform your doctor. The medications mentioned above are primarily for primary hypertension. If you have secondary hypertension, meaning your high blood pressure is caused by another condition, such as kidney disease, e.g., renal artery stenosis, you must first undergo surgery to address the underlying condition. This may normalize your blood pressure or reduce it, potentially eliminating the need for blood pressure medications. Therefore, for hypertension patients, it is essential to first visit a hospital to determine the type of hypertension you have. If it is diagnosed as secondary hypertension caused by another underlying condition, you must first treat the underlying disease or cause of the hypertension. This is the key to controlling blood pressure. Using antihypertensive medications alone is often ineffective for controlling secondary hypertension. Only targeted treatment of the underlying cause can achieve better results. All right, that concludes our introduction to hypertension. If you have any questions, comments, or additional information about hypertension, please feel free to leave a comment below the video. If you are currently experiencing hypertension or have accompanied a loved one through it, please share your experiences in the comments section. Your valuable insights and experiences may help others or even provide the answers they are looking for. All right, everyone, take care of your health, and we'll see you next time.